All right, getting started with some quick introductions. So I will first turn it over to Michele Kawabe with the Michigan Department of Health and Human Services for a quick introduction. Michele?
Hi, everyone. Thank you for joining the informational webinar this afternoon. My name is Michele Kawabe, and I'm the team-based care lead public health consultant at MDHHS in the Heart Disease and Stroke Prevention Unit. And in my role, I work with various partners on programming focused on detection, management, and control of cardiovascular disease. So MDHHS is partnering with the Michigan Center for Rural Health on this funding opportunity. So I'll be working with Sarah and her team, as well as the awardee of these funds on the project. So again, thank you, and I'm here to answer any questions or support you in any way. If you'd like to reach out to me via email, feel free to do so.
Thank you, Michele. And my name is Sarah Morin. I'm the Population Health Programs Manager at the Michigan Center for Rural Health. And also assisting me with this project will be Jill Osterly and Crystal Barter, also with my office. So the Michigan Center for Rural Health does function as a state office of rural health, and we have a number of other service lines related to rural health funding opportunities. And we are excited to partner with Michele and her team to be able to offer the one that we will be discussing today. Any questions before we get started? All right, hearing none. Go into a brief purpose on this funding opportunity. So this was included in the funding announcement that was disseminated along with the registration link for this technical assistance webinar. So this shouldn't be a surprise to anyone, but the purpose of this funding opportunity is to affect heart disease in rural Michigan. So we know that heart disease remains the leading cause of death, both nationally and within Michigan, with our rural residents and individuals in minority populations having an increased risk. So the purpose of this funding opportunity is to implement a team-based care model to take a coordinated collaborative approach to patient identification and management to increase efficiency and utilization of staff members, patient care responsibilities, and assist with the workflow. We will also be tying in a technology component to this funding opportunity. So we'll get into a little bit more detail now. So some specifics on the funding opportunity. We'll be awarding one clinical site for 2 years of funding with the purpose of identifying and addressing health disparities through technology to enhance team-based care approaches to managing cardiovascular disease. So the first year of the project will be spent using your EHR to identify the clinic level disparities that you can identify, and then developing a PDSA cycle to include the team-based care component that you'll use to address those identified disparities. And then in year 2, we'll be working with you to implement that Plan, Do, Study, Act cycle. So
Sarah,
eligibility. Yeah. Oh, go ahead, Michele.
Oh yeah, hi, this is Michele. Just want to clarify because I did get a question from someone about this yesterday. When we say the $24,000 for 2 years, just to clarify that, it's a $48,000 total award, and that'll be divided, $24,000 per year. It's actually, I believe, 18 months the way the cycle starts, but I just want to clarify that the total award is actually $48,000. So.
Thank you. Appreciate that clarification. Yes, $24,000 for 2 years would not be a lot of funding. So happy to be able to award $24,000 each year for the 2 years. So thank you for that clarification, Michele. So eligibility for this funding opportunity is adult primary care service sites within central to northern regions of the Lower Peninsula, Upper Peninsula, and the Thumb areas of Michigan. So you can see in the map on the screen and in the funding announcement, the eligible counties for this work. So the eligible counties are the ones highlighted in green. The timeline for this funding opportunity. So the funding cycle did open October 1st for applications. Applications are due to us by October 29th, with the awardee being announced by November 30th, so no later than that. We'll be distributing funds by January 1, 2022, with an implementation period starting that January 1st, 2022, going through September 30th of 2023. I'll take a moment to pause for questions here. Any questions, please feel free to either unmute yourself or use the chat box.
Is eligibility for rural health clinics only, or any clinic within the rural area that's highlighted on the map?
Michele, I will lean on you to help answer that. Are you looking for certified rural health clinics only, or any primary care site in the eligible counties?
Any type of primary care service site, as long, adults, obviously, we're focusing on 18 years and older, but you don't have to have the rural health clinic certification. Specifically, it could be any adult primary care site.
Thank you. Any additional questions? All right, we'll quickly talk through the required grant application elements. First off, we did not intend for this application to be overly complicated. Just wanted to get a feel for what a proposed project might look at. So all of the applications must contain a narrative description of the project along with a corresponding work plan and budget. And we do have a breakdown of what these components will include in the following slides, and then also some templates are available for this work as well. So first, the narrative and disparities section. So we're asking you to describe the need for improvements in team-based care within your practice and the ways in which the project will improve the ability of non-physician team members to treat patients, the projected impact of the project on cardiovascular related health outcomes within your population, any major social determinants of health that impact health risk and outcomes of your practice population, along with identifying any disparities that exist within your region and the ways your practice currently addresses those social determinants and health disparities. We'll also ask you to describe how your practice will utilize technology to identify the disparities among your patients with hypertension and/or hyperlipidemia, and how the project will work to eliminate or mitigate those identified disparities. And then all aspects of the proposed project, including planning, implementation, and evaluation, and then its sustainability post-funding, are all components for this narrative section. We do have a statement here that applicants are required to use the EHR to identify clinic level disparities, and then again to develop that PDSA cycle in year one to include the team-based care component to address those identified disparities that are required to implement in year two for that PDSA. The next section is a brief work plan, so just clearly outlining all of the project activities along with corresponding timeframes for completion and outcomes expected for the activities. So we do have this work plan template available. I think it's hyperlinked within the funding announcement, but please let me know if you can't locate that, and I'd be happy to provide this. Additionally, we have available a budget template, again, within that funding announcement, but let me know if you are having trouble locating it. I'd be happy to provide that as well. So matching funds for this funding opportunity are not required. And then we do have a brief list on some prohibited expenses that are tied to this funding opportunity. So the last slide I think we have here is on some fundable project examples. So this list is not all inclusive. It's just a collated list on things that we think could be funded, or ideas to help you along this work. So I'm not going to read all of these to you. They are again available in that funding announcement, but please feel free to take a look at this list and let us know if you have any questions, if you want to talk through any sort of questions you have about the application, or if your project is fundable and meets the requirements prior to submission. We're happy to provide any technical assistance to make sure that your application does meet the funding criteria. And that is all of the information we have prepared this afternoon. Are there any questions or clarifications that we can provide at this time?
I did miss the start of it. I'm assuming you're going to send the slides out.
I can certainly send out the slides.
Okay, thank you.
Any additional questions or clarification requested on this funding opportunity?
Or if
All
anyone
right.
has some ideas they'd like to run by us while you have us on the line, that would be fine too.
All right, well, hearing none, we won't keep you too much longer. Again, just please feel free to reach out to either Michele or myself with any questions for this opportunity. We are excited to be able to offer it to our rural health clinics to be able to assist with this work. So I guess if there are no further questions or comments, we will go ahead and conclude this afternoon's webinar. Michele, do you have any closing comments for us?
No, you covered it very well. Just again, want to extend the invitation. If anyone would like to run any ideas by me or Sarah, or has any questions that you think of later, which always happens to me when I'm on a line, feel free to send me an email, and I'm happy to help as I can.
Thank you. Well, everyone, I hope you enjoy the rest of your Tuesday afternoon. We'll give you some time back in your very busy schedules. Again, please let us know if you have any questions. And we look forward to seeing some proposals. Thank you and have a wonderful rest of your day.
Thank you, everyone. Bye-bye.